If you suffer from back or neck pain, you know how debilitating it can be. You also know how intimidating it is to get help. With so many options, it's often difficult to know where to go to get relief. Dr. Ricky Kalra of Kalra Brain and Spine wants to give you the life-changing care you need with the least invasive options for your condition. Good morning, Dr. Kalra.
Good morning.
Nice to have you here. All right, as a neurosurgeon, what makes you an expert in spine health?
So neurosurgeons spend almost 8 years training how to operate on the spine, the brain, the nerves, and the vertebral column. Compare that to some of the other experts, chiropractors, physical therapists, orthopedic spine surgeons, even pain doctors. Most of them get maybe 24 months of training. So I spent an extra 6 months after my training in Germany just trying to learn the new technologies coming out of Europe. One of the interesting parts recently actually is that my practice has completely changed. Because of these new technologies coming out, some of these other experts are now starting to send patients to me just because they want their patients to get least invasive, and so the newer technology is coming out of Europe.
So what brought you to Dallas-Fort Worth, our area?
So I grew up in Plano. I moved to Plano when I was 14 and loved the city. I loved the neighbors, the people. I went to high school there, went down to Houston at Rice and wanted to move back. And so when I met my wife in residency, I said, we're moving back to Plano. And sure enough, I lived 2 miles down the road from where I grew up.
Oh, wow, that's great. So we love to hear that you love DFW. Tell us more about the spine treatments that you offer, because this is really debilitating for people.
Right. And that's what I tell patients when they come to see me. I say, look, tell me why you're here, because it's often not a pinched nerve or a disc that they're talking about. They say simple things like, I can't throw the ball to my son. And so we start at the basics of what they want to get back. And then we try to design a multi-modality treatment. It can be physical therapy, medications, lifestyle modifications, and sometimes even surgery. But the idea of surgery has changed. The surgery we think of as the ones from the TV shows, and those aren't real anymore. We're using small incisions, minimally invasive techniques like an artificial cervical disc, and we're seeing patients go back to work very quickly.
Okay, you mentioned the artificial cervical disc replacement. Can you explain a little bit more about that? Because that is a new thing, relatively new, and very effective, right?
Right. So it's an alternative to fusions, and we're starting to notice that patients are coming in with disc herniations that are pinching on nerves. So I'll give you an example of a young lady that I saw, mom of 2, CrossFit, avid CrossFit, and her left arm hurts all the time. She's done pain management, she's done physical therapy, now she's done narcotics, and things aren't getting better. So she went to go see a neurosurgeon who said, you need a fusion. She came to see me, and I said, look, let's try an artificial disc, where we went in, took the disc out, and put a prosthetic device in that holds sort of the same space open and gives her the same range of motion.
I'm amazed at what you can do these days, what doctors can do with technology. It's so wonderful, things like that, instead of what used to be available. What would you say to people who may be watching who are experiencing back or neck pain?
Right. I'll tell patients, look, if you're having back pain, neck pain, arm pain, leg pain, it's coming from your spine, you've done the physical therapy, you've done the narcotics, and things just aren't helping, it's time to see a neurosurgeon or 2. And I tell most of my patients, get a second opinion before you commit to a surgery, because there's a lot of new technologies out there, there are new ideas out there. For example, in this patient, she's back to doing CrossFit, and it's been 2 weeks in surgery. She has no collar on, she's on no medication. So sometimes there is a magic here. Most of the time it requires a little longer, but the technology's really made it impressive.
All right, thank you so much for coming in today and telling people what you have to offer. It's fascinating to me how many advances have been made. Kalra Brain and Spine is located in Frisco. You can call 972-905-9226 for more information, or go to kalrasurgery.com.